morning everyone, Adrian Uy here, consultant plastic surgeon at Polaris Plastic and Reconstructive Surgery. And today we'll be talking about facelifting. So unfortunately, the ravages of time are real. And as we get older, the first place where you can see it is usually the face. Words such as, you look tired, or you look haggard, or you look very fierce. These are all indications that perhaps you can consider a facelift. So in terms of lifting the face, you do have minimally invasive options, and we will talk about this in another video. However, for a real powerful and lasting effect, surgery is the way to go. Usually, when we perform a facelift, we say that it will last you 10 years, meaning that if I perform a facelift for you today, it will take 10 years before you get back to where you are today. Whereas for the minimally invasive options, such as thread lifting or HIFU, these usually last maybe 1 to 2 years at the most. So, who is the ideal candidate for a facelift? Most of the facelift candidates that I see are maybe in their late 40s to mid 50s, and this is the time when the signs of aging become the most prominent from their 30s through to their 50s. Also, in the late 40s and early 50s is the best time to have a facelift done because it will last you 10 years, meaning once you reach mid 60s, not many people think of ever having to need another facelift at that stage in time. So, what are the features of an aging face? We can divide the face into the upper third, the middle third, as well as the lower third. In general, for the upper third, you can see a very droopy brow, formation of multiple lines at the forehead, and a very fierce appearance. For the mid-face, you can start seeing very deep lines just around your nose. At the same time, you can also see very dark eye circles and very loose skin in the mid-face. Finally, for the lower face, and this is the kicker, you get very deep jowls, a very saggy chin, and in the neck, especially for those approaching their 60s, you can see a very crepey, wrinkly appearance of the lower neck. So what can we do with a facelift? In the past, facelifts used to be avoided because of the very obvious scars that people thought they left behind, as well as the very unnatural, face-lifted, windswept appearance that some of the older facelifts used to leave. And I think if you look at some of the older celebrities who perhaps had facelifts, you can see these sort of windswept results. We can now produce a very natural, lifted result that reverses aging without leaving very visible scars. Starting from the brow, you can perform a brow lift using hidden scars. Some of these scars can be hidden in the hairline or behind the hairline, and some of them can be hidden in the hairline, especially for ladies who want to restore the brow arch of youth. Moving down to the mid-face, you can perform a mid-face lift through a lower eyelid incision, which again hides the scar very nicely just beneath the eyelashes here. That helps to lift the folds right beside the nose, as well as get rid of the lower eye bags, bringing the volume from way up down to way up top where it should be. So for the lower face and for the neck, we can approach those areas through very well hidden incisions in the hairline and around the ear, such that after they heal, they are barely visible. At the same time, we can pull the layer of the face which really ages, which is the muscular layer of the face, and remove any excess skin which is left behind, leaving a very natural, non-windswept appearance. So for the mid to lower face and the neck, I actually perform what is called a deep plane facelift, and this is a very advanced technique which requires years of training. In this technique, I actually pull a layer called the SMAS, which is the layer surrounding the musculature of the face, such that when it is tightened, it brings the volume which is descended upwards, as well as gives the patient a very natural lifted appearance because you're not pulling just purely skin. After that layer is pulled, any excess skin which is left behind is then removed in a tension-free fashion, such that when we do our suturing of the wounds, it leaves behind very little scarring. In more recent times, many of you would have probably heard of things such as the ponytail lift or minimally invasive facelifts. These can also be performed, but they're only for very select patients who don't have that much loose skin or who require less of it. So in some instances where the sagging is not so severe, or in younger patients, the minimally invasive facelifts such as a ponytail lift can be appropriate to help to change the appearance of the brow, for example, to give a more fox-eyed appearance, or even help to lift part of the lower face without leaving any potential scars around the ear. And these are performed through incisions in the hairline. As to which technique is suitable for you, it is important that you meet with a well-trained plastic surgeon who has these options available, and through discussion, can meet your expectations.